Okay, thank you very much. It's a great pleasure to be here. You'll be pleased to know I shortened the title somewhat for my presentation because I thought it might take 12 minutes just to read it out. So apologies for that. So I'm going to talk to you this morning about the cost effectiveness of specific mastitis control interventions and also a little bit of a continuation of that work into the associated reduction in antimicrobial use. So just to start off with then focusing on cost effectiveness. Just to set the scene, I'd like you to imagine that you have been contacted by a dairy client because they're having problems with their mastitis. And as you heard from Peter Edmondson this morning, a good place to start is trying to diagnose where new infections are coming from. So to do that, we take a look at some data. So this is a fairly typical report looking at dry period clinical mastitis cases. So across the bottom there, we've got the months of the year. We've got the cows at risk, if I can find this pointer, in the bars. We've got the incidence rate in the blue line, and we've got a target here, which is sort of 1 in 12 cows. And as you can see, in terms of dry period infections, most of the time we're well within that target, apart from the occasional blip. So dry period mastitis seems to be relatively well under control. Have a look at lactation, new infection rate here. So here we've got, again, same sort of graph, months across the bottom. We've got the number of cows at risk in the green bars, the actual incidence rate, which is the green line. Apologies for the horrible colours, by the way. And then the target here, which is 2 in 12. So this is clinical cases that happen after the first 30 days of lactation. And as you can see, by comparison, quite a much bigger problem with cases of lactation origin rather than dry period origin. Carry on and have a look at some cell count data. This is just looking at the prevalence of high somatic cell count cows. Again, we've got the month of the date of milk recording across the bottom. And then we've got the green line is the prevalence of cows over 200,000 cells per mil, which you can see is running at about sort of just below 20% each month. And then we've got the proportion of chronics running at sort of just below 10%. So we would tend to consider this a fairly low prevalence herd. And we then have to sort of come to making some sort of decision. Do we think this is a problem associated with predominantly environmental pathogens or contagious pathogens? And do we think most new infections are stemming from the dry period or lactation? In this case, we'd probably go for something like this. So we'd probably think, okay, looks like the pathogens are behaving in a predominantly environmental way, and most cows are becoming infected during lactation. So that's our working diagnosis. So we then go to the literature and we try and ascertain, we look at the risk factors for this sort of mastitis, and this is what we kind of come up with. Don't try and write these down, by the way. A few more to go. You got all that? So that's probably about half of them. I got a bit bored after that. As you'll appreciate, and as other speakers have kind of alluded to already, Dr. Deng included, there's a lot of risk factors for mastitis, particularly environmental mastitis. A lot of research gone on into this. And so we've got a bit of a problem, haven't we? We've got to make some decisions. We can't try and implement all of these, or the farmer might not ask us back to that farm again. We've got risk factors associated with the cubicles, straw yards, routine in the parlour, what we do with the heifers, biosecurity, the milking cow housing, grazing management, mastitis treatments. The question we need to answer is actually which of these interventions are most likely to be cost effective for each individual farmer. Okay. How do we prioritise which of these interventions we're going to choose from? So to try and answer this question, I took data, somatic cell count data and clinical mastitis records for a bunch of UK dairy farms when they were first enrolled on our National Mastitis Control Plan. That's this one here, the HDB Mastitis Control Plan. This is our national scheme in the UK. I also collected all of their questionnaire data. So when a herd enrolls on this plan, a vet or a consultant visits the farm and goes through a really detailed questionnaire. So 377 questions and observations. So a really detailed amount of information there in terms of their current mastitis management and farm management. I also collected data on which interventions were actually implemented by each of these farms during this plan. So we'd normally encourage farms to implement 4 or 5 mastitis interventions in the first instance, and then these are sort of changed accordingly as going forward from there. And I collected this data for 73 herds in the UK that all had a problem with environmental lactation period mastitis, i.e. The majority of the cases of mastitis on those herds were driven by environmental pathogens that were causing infections during lactation. So I did some modelling with this data, and it's an integrated Bayesian model consisting of a multi-regression model, which was effectively measuring the impact of specific mastitis interventions on their clinical and somatic cell count. I also had to include their current rate of clinical mastitis and their current somatic cell count, because that's obviously going to have an impact on the overall cost effectiveness. I put in a distribution for the cost of clinical mastitis and cell count problems, and also different costs for each intervention. So what is it going to cost to implement? That's obviously going to be different for each farm. Hopefully you'll appreciate that for all of these model inputs, I've put them in as probability distributions. And it's really important because with all of these inputs, there's a lot of variation, a lot of uncertainty. And the beauty of this integrated Bayesian model is that we can capture all of that parameter uncertainty, and that can then be fed through into the model output. So using Markov chain Monte Carlo simulation, we arrive at an incremental net benefit, and it's from this that I can then make hopefully clinically useful predictions. So I'll give you an example of the sort of typical model output here. I've just selected one intervention, which is cubicles designed so that 90% of cows lie in them correctly. Across the bottom here, we've got their starting rate of mastitis, which is number of cases per 12 cows. Up the y-axis here, we've got the probability of saving £1,000 over a 12-month period. That's about 143,000 Japanese yen, or about 1,300 US dollars. And then the different colours correspond to different costs to implement this intervention. So, for example, if we had a herd that had a rate of mastitis of 2 in 12, and it was going to cost them £250 to adapt the cubicles so that 90% of the cows line them correctly, then they'd have about an 80% probability of saving £1,000 over and above that investment within the first 12 months. However, if we had the same herd, but it was going to cost them a lot more to adapt these cubicles, so it's going to cost them now £2,000 to modify their cubicles, they're going to have a much lower probability, so less than 50% chance now of making that £1,000 in the first 12 months. So hopefully you can appreciate it's a very flexible approach depending on different herds' situations. So from that modelling work, the interventions that came out as most likely to be cost effective for most herds were things around ventilation, pasture rotation, interventions affecting the amount of space the cows have, both in terms of lying and loafing and feed space, pre-milking teat disinfection, straw yard hygiene, fly control and biosecurity. So possibly not too many surprises there. So I've continued this work into looking a little bit about antimicrobial use, and not only looking at the cost effectiveness of these interventions, but also what impact they might have on antimicrobial use. I don't need to tell you why I might look at that. It's obviously a very important subject. These sort of quite gloomy predictions that AMR is going to result in 10 million deaths by 2050. And those of you that work with dairy herds will appreciate that as this sentiment sort of raises, antibiotic use in dairy herds is largely an udder-related management practice. So we know that most of the literature would support this. Mastitis control, treatment, prevention is a big reason for antibiotic use on most dairy farms. So it's a reasonable target in terms of trying to reduce antimicrobial usage. So I've used exactly the same modelling technique as I've explained previously, but I've added some other distributions in terms of how many tubes a farmer might use to treat a case of mastitis, and also obviously different tubes contain different amounts of active ingredients, so I've had to try and incorporate that into the modelling as well. And then we can look at sort of what the level of reduction we might see. Again, you'll appreciate there are different ways of measuring this, so I've just used the SVAC sort of a methodology in terms of DCD, DD and milligrams per PCU. And I've modelled this in a 120 cow herd. And you can see that the sort of levels in reduction in terms of DCD sort of ranging from about 0.05 up to about 0.23. So fairly modest reductions at an individual intervention level. But obviously, most farms would tend to implement 4 or 5 different interventions, and then when you start adding a few of these up, you actually get quite a reasonable reduction. I've tried to give it some perspective here, so that's the UK median for DCD, based on the most sort of up-to-date literature we've got on that, which was published last year. So in terms of DDD, these are sorts of reductions that we see. So again, ranging from 0.2 up to about 0.7. And then in terms of milligrams PCU, these were the sorts of reductions that I got to, ranging from about 0.2 up to about 0.9. So this work is ongoing. There'll be a bit more of this to come out, but I wanted to present some of the preliminary findings to you here today. The point of all this work, the cost effectiveness and the AMU work, is to put all this into a decision support tool, which might end up looking a bit like this. This is a sort of an early version of it, so that individual farms can put in their own data, so how many cows they've got, what the costs of mastitis are, their own incidence rates, their own herd sizes, and also they'll also be able to put in how many tubes they tend to treat cows with, whether they use any systemic antibiotics and those sorts of things, so that we can make very farm-specific predictions based on the modelling work that I've done. And hopefully in this way we can help farmers and vets to prioritise mastitis control in an evidence-based way and really optimise the decision-making in this area. So that's me. I want to thank BBSRC and HDB for their funding, for my supervisors who have been really helpful. And I'm just going to put a shameless plug in. We've got a couple of positions available at Nottingham, so come and have a word if you're interested. Thank you very much.